In this video, I am again discussing a communication. It is a recall communications. It's come on 2019 plus. Okay. The task was that ST4 talking to the mom of a child who was admitted overnight with 3 days history of fever and upper respiratory tract infection symptoms. He had chest X-ray showing right-sided upper lung field changes. Started IV penicillin. CRP was 5. White cell count was normal. On review, the following morning, the radiologist reviewed chest X-ray and started the change was probably the normal thymus shadow. So it was not pneumonia, wrongly diagnosis, thymus shadow. The consultant wants to stop the antibiotics and discharge the child. The mom was confused with the news the nurse had told her. Talk to mom. So here what happened, I checked mom's knowledge. She was confused how the child get better so quickly, especially for pneumonia. Did not really understand. I clarified the events as per the clip sheet, stating that the admission team acted well to address what they thought as pneumonia, but that now with information reviewed plus blood plus improvement, chest X-ray normal, blood reassuring symptoms is upper respiratory tract infections. This is viral. Then stopping the antibiotics. Happy to review the child first, but that the solution, that the situation checked they were eating and drinking, addressed antibiotics, reassured and open access, and what that means. Mom is very happy. Examiner is happy. Long silent until the bell. Okay, so that is the first pneumonia diagnosed. Later discovered that is a thymus shadow. So the type scenario we call gray zone between the sorry and the apology. We'll make it as apology scenario, but we will justify ourselves. So as usual, introduction, IRCP, introduce myself, making a report, taking the consent, agenda, then the attendance and the prior knowledge. So actually during morning round with consultant, we discovered that we thought as pneumonia, it is actual normal findings in the chest. That is called thymus gland. The mother is asking what is that? The thymus gland is a normal finding present behind our chest bone, pointing to your sternum, and it is having a very important role in the defense system. So we'll draw a picture of the lung like triangular to shape and a between a circle that is a thymus shadow. We tell that between two lungs there is a structure that is called thymus shadow. Mother is telling, I do not understand. My child doesn't have pneumonia. No, he doesn't have pneumonia, but he is improving. Most probably, he has a viral pneumonia which improved on nebulized saline, painkiller, and treatment of fever we gave him. So he did not need these antibiotics. I'm sorry to tell you that it was unnecessary. Now mom is angry. So what will happen to him? He took these antibiotics unnecessarily. Had you lost your mind? Actually, 2 doses of antibiotic are less likely to cause any harm, but meanwhile, we will monitor his conditions. He is under our close observation, and if anything happens, we will interfere immediately. Are you with me? So we tell that that is not pneumonia. It probably viral pneumonia. Antibiotics we have given unnecessarily, and she improved because we given antibiotics, fluid, everything. That's why. And then mommies, if asked that the antibiotic unnecessarily given its side effect, the two antibiotic works actually not that much effect. But if anything happen, we interfere immediately. We monitoring him. Next. No, not with you. How can you make such a stupid mistake? You are a doctor and do not know how to diagnose pneumonia and do not know how to read the chest X-ray. I'm totally understanding your feelings, but this sometimes is confusing because this gland is different in shape from one person to another. Are you with me? So even in the same person, it is different in shape when breathing out and breathing in. It is thin in breathing in and wide in breathing out. That is why it is confusing sometimes at pneumonia. So this thymus gland, which is act part as a defense system, it is variable in shape, and sometimes breathing in it's small, breathing out it is increased in size. So it's really confusing to diagnose pneumonia or not, and to take him to the another hospital. I totally understand how much you are frustrated, but we are familiar with Ali's condition, and he started to be familiar with us. Do you prevent me? Actually, it is totally your right. Once he is stable, I will discuss it with my consultant. I will complain. Ma'am, I tell you, I'm totally understand your feelings but and appreciate your worries, but let me reassure you that he is okay and now, and he will keep you, and we will keep our eyes on him. I will complain. It is totally your right. I will guide you through the pediatric advice and liaison service. So, mother, when go another hospital, we tell that we are familiar with him. He is also started familiar with us. And about another complaint, we tell one or two line. After that, we guide about the pulse. Then summary trusted website leaflet we have given. So this is all about the communication of thymus, which is wrongly diagnosed as pneumonia. It is a gray zone scenario. Remember, gray zone is called between the sorry and apology. Here, we make it apology, but we will justify ourselves. Thank you for this communication.